Hi guys, my name is Abhyuday Srivastav. I'm a dentist by profession, and just like all of you, I'm also stuck at home because of the lockdown due to this coronavirus that is spreading like wildfire across the globe. So I did a bit of reading from the internet, from trusted websites, and I gathered some facts about this disease, and I'd like to share in this video what I think are the relevant facts for dentists, especially Indian dentists, regarding this deadly disease called COVID 19. So, the recent coronavirus outbreak in India caused by the virus SARS-CoV-2 has become a cause of worry for healthcare professionals. A large chunk of the population is able to recover without hospitalization, but around 20% need ventilators and ICUs. Due to the rapid growth rate of this virus and its ability to create asymptomatic super spreaders, it is deemed to be a deadly virus. It's happening the world over, and most of the countries are taking drastic measures like lockdowns and shelter in place to control the spread of this pandemic. This disease that this virus causes is named COVID 19, which is short for coronavirus disease 2019, because it's a respiratory illness caused by a novel coronavirus and has originated in 2019 in Wuhan, China. Since its outbreak, various health agencies have released guidelines for healthcare workers in general and dentists also in particular. So, here are some of the guidelines compiled from various sources. You can please feel free to cross verify with your local administration and government. Your response should depend on the severity of this outbreak in your region. So, the first thing that, as a dentist that you should do is close down your practice for some time. Now, this might sound like a drastic step, but for dentists, this is a major decision. The dental equipment that you use, your scalers, your aerators, all of these produce aerosol, which is inhaled by your patients during the procedures and also in the waiting area. So, this aerosol can be very dangerous if you are treating any of the carriers of the disease or any of the patients. So you should consider closing down your practice for some time, and you can continue to function during emergencies, your dental emergencies like major swellings and major operations that you like jaw fracture operations. Those surgeries you can do, but you have to follow the protocol provided by the government and the agencies. Now, the second point is before you close down, you have to take care of your clinic. You have to lubricate your aerators and you have to take care of the compressor. Take care that all your instruments are in good shape before you leave them. The third point is you have to screen the patients even before they enter your operatory. So, in your waiting area at your reception, you can create certain compartments or cabins where a patient is only allowed to enter your reception where most of the patients are seated after they fill out a questionnaire where they give you a history of first their travel and second any history of respiratory illness or any contact, thirdly any contact with a COVID positive patient. If you find any of the patients which are suspicious for COVID, you have to refer them to the proper authorities. The fourth point is make the patients wait in their cars or limit waiting time. You have to keep your appointments far apart so that you can isolate your chamber, you can sterilize all your instruments. You have to use the plastic wraps for your chair, and you have to use all the proper equipment. And before that, the contact from one patient to another also should be limited. So it's better to have a telephonic conversation before the patient comes in, and you can tell the patient to wait in their car and they'll be called when their chair is ready or the appointment is ready. The fifth point is you have to wear the proper personal protection equipment before your emergency surgical work. Even if you have to open the clinic, you have to take care of yourself first. So you have to use, instead of the surgical mask, if you can procure the N95 masks, that would be great. And also your gloves, your head cover, your disposable gowns, your eye protection, and your face shield. Once everything is in place, only then you can proceed with the procedure. And of course, the procedure should not be anything that aerosolizes the virus. You have to use only procedures like extraction and other minor work. The sixth point is you have to prepare a consent form. Your patient should know that this dental practice is possibly a hotspot for this virus. So they should give you an informed consent for the procedure before you carry out the procedure. Seventh point is you have to provide proper protective gear to your staff also. The people who are working in your reception, they should be given at least the surgical gloves, surgical mouth masks, and examination gloves. And the eighth point is, if you're generating biomedical waste that is suspected to be COVID-19 positive, you have to dispose it responsibly. You have to label the waste separately from your other waste, and do not mix it, because the people who are processing the waste in the facility might contact the illness just because you forgot to segregate your waste. So label it properly, seal it, and only then send it to your waste disposal authorities. I hope these points help you in your practice whenever you choose to open, or whenever you choose to continue or resume your services. All the best to everyone. Stay safe, stay indoors.